Is your GLP-1 copay going up? You're not alone. Hey everybody, welcome back to my channel. My name is Armando. I am a type 2 diabetic, and for the last 11 months I've been treating that with Mounjaro. So a really interesting article here today from the USA Today, just examining the growing cost of GLP-1 medications for both consumers, patients like you and I, and our employers and our health insurance providers. And so the article highlights this one woman here who currently is on Wegovy. Her copay is $25, which is incredibly affordable for her. However, her insurance plan is changing the tier level of Wegovy beginning January 1st. It's going to be now a higher tier number, like a tier 4 or 5, which the higher the number, generally the further away from like generic or basic it's considered. And so the higher the number, the higher the cost. And so her new copay is going to be $750, which is no longer going to be affordable for her on a month-to-month basis. The article also highlights that many states have been removing coverage for GLP-1 medication, specifically for obesity, from their Medicaid and Medicare programs. Many states no longer cover it. And only 1% of the Affordable Care Marketplace plans actually cover GLP-1 medications. Now, the good news is that 44% of large companies, large corporations that employ more than 10,000 people do cover a GLP-1 for weight loss. However, of those, only 4% don't place any type of restrictions to access those medications. So in other words, most employers that do cover GLP-1s for obesity have restrictions in place. You know, you must have a certain BMI, you must have certain comorbidities, and you must have typically enrolled in some kind of nutrition, dietitian program, a WL program, you know, something to that effect. Yeah, some people are placing a lot of hope in the new Biden administration proposal to cover GLP-1s for weight loss within Medicare and Medicaid in 2026. However, I don't think that has any chance in hell of happening, unfortunately, because it would require the incoming administration to do the official sign-off or approval on that. And to do this, the price tag is $40 billion. And we know the incoming administration is incredibly focused on reducing governmental spending and decreasing the role of the federal government. So to think that the new Governmental Efficiency Office and our new Health and Human Services Secretary is going to sign on to a $40 billion expense, I don't think that's going to happen. Now, many lawmakers are pressing for these pharmaceutical companies to kind of stop price gouging, but they are under patent protection. Wegovy, as an example, doesn't expire till 2032, and Zepbound's patent doesn't expire till 2039. Now, thankfully, we have our various telehealth companies that do provide access to the compounded version of these medications, semaglutide, and some are still providing tirzepatide. However, we know the FDA and the manufacturers are coming after compound, and we are expecting to hear from the FDA this month, probably for both tirzepatide and semaglutide, a final update for them. But let me know how you are all doing. How is it looking in terms of your insurance, your copay? Have you been able to find your medications at your local pharmacy? If you're on compound, how has that been working for you? And what is your potential plan if the FDA takes away the various compound that we currently have access to? But let me know in the comments, everybody. Click all the buttons and click that follow button. Thanks.